In this video, I'm going to walk you through the bones that make up the appendicular skeleton. So this is the second half of what we started last week when we were doing the axial skeleton, so the skull, the thoracic cage, and the vertebral column. So now we're going to talk about the upper and the lower limbs, as well as their anchor points, aka the pelvic and the pectoral girdles. So the upper limbs, they include the arms, the forearms, and the hands. The pectoral girdle is going to involve the shoulder blades and the collarbones. The lower limbs, okay, that's your thigh, shin, and feet. And then your pelvic girdle is the coccyx bones, your hip bones that make up part of the pelvis or pelvic bowl. So we're going to start with the pectoral girdle, and it's relatively simple. So we have the thoracic cage, and then on either side, on the left and right, we're going to have a clavicle and a scapula. So the clavicle, that is what comes across the top of your chest. That is your collarbone. Okay, and then it, as you can see, articulates with the sternum, and then laterally with the scapula. And the scapula is your shoulder blade. As you can see, it's a pretty flat bone with a few pretty unique shapes here, which these processes here, the chromium and the coracoid processes, are attachments for muscles. And then the glenoid cavity, that's where the humerus is going to articulate with the scapula. Okay, so you can see how it all fits together here. The clavicle attaches to the sternum, and then over here it attaches with the scapula, so it forms an articulation here and here. The scapula does not form any sort of articulation with the ribs, okay, so just be aware of that. It's going to be embedded within muscle. And then the humerus, as you can see here, is going to form the shoulder joint here with the scapula, but it does not articulate with the clavicle. Okay, so if we're looking at the arm, so here we're looking anteriorly at the arm, and this is a posterior look. So we have the clavicle in front, the scapula in the back, and then the humerus articulating it with it laterally. And then the ulna and the radius, these are the two forearm bones, and the ulna is what is going to kind of hook into the back of the humerus here in the back of the elbow. If we were to look at the ulna, which we will in a moment, it kind of, at this point, it kind of looks like a little scoop or a little hook. And then the top of the radius kind of looks like a golf tee. Okay, so these are the two bones in the forearm, and then they come down and they articulate distally with the 8 carpal bones, which then articulate with the 5 metacarpals, which make up your hand. And then they articulate with the phalanges. And in each of your fingers, you're going to have 3 phalanges. And then in your thumb, you will have 2. And we're going to see that pattern again when we get down to the feet. So just a couple of things. The radius, as we can see here, it makes up the bulk of the articulation down here with the wrist. And you can see how it runs alongside the thumb. Whereas the ulna, which makes up the majority of the joint up here at the elbow, is going to have a smaller role in the wrist joint down here, and it's going to run along the pinky side of the hand. Okay, so just a few things to keep in mind. There are 8 carpal bones in each hand, 5 metacarpals in each hand, and then 14 phalanges in each hand. So if we're looking at the hand a little bit more closely, the phalanges are divided up into 3 different groups. So we're going to have proximal phalanges, middle phalanges, and distal phalanges. So these are just in reference to how close they are relative to the trunk. So these proximal ones, these are the biggest ones, and they're going to be closest to the trunk compared to the middle and then the distal. And then down in the thumb, we're not going to have a middle phalanx. It's just going to be a proximal and then a distal phalanx. There are 5 metacarpals, okay? And notice how we have these numbers. So these numbers are going to apply to each finger and each metacarpal. So number 1 is going to be a thumb, number 2 is the pointer, all the way to number 5, which would be the pinky. So just keep in mind those numbers. It starts with the thumb and goes all the way to the pinky, 1 to 5. And then, of course, the proximal, distal, and proximal, middle, and distal phalanges. Those are self-explanatory as long as you know your anatomical directional terms. And then that's going to bring us down to our wrist bones. Okay, so the carpals. As I said, there are 8 of them, and we have the scaphoid here. That's going to be the first one. So if we're going along the thumb or the radius, the first one, the more proximal one, okay, lateral one is going to be the scaphoid. And then we get to the lunate, okay, next to that. And then the triquetrum, and then the pisiform. And then in the next row, we have the trapezium, trapezoid, capitate, and then hamate. All right, so there are 8 of them. So if you want to use a mnemonic device, the one that is commonly used is, so we have S, L, T, P, T, T, C, H. Sally left the party to take Kathy home. So Sally is the responsible friend, and then Kathy might be the one that enjoys a good party. So anyways, so scaphoid, lunate, triquetrum, pisiform. Sally left the party. Trapezium, trapezoid, capitate, hamate, to take Kathy home. So looking in the elbow joint, we have a bunch of different features here. You're not going to need to know these at this point, any really of the features. Knowing the bones is going to be enough, but you can see a few different features. You'll probably hear trochlea and capitulum again. These are just the portions of the humerus that the ulna and radius articulate with. And then the olecranon fossa, so that's the little indentation in the humerus that the ulna is going to move within. And then the olecranon process is going to be the portion of the ulna that fits into the olecranon fossa. Okay, and remember, this is the back of the elbow, so the olecranal region, that should make a little bit more sense now. Okay, and then down here, we got the radial and ulnar tuberosities. These are going to be attachments for muscles. Few features of the humerus. You have the head that fits into the scapula, the anatomical neck, as you can see, that kind of separates the head from the rest of the bone. The surgical neck, that is the most frequently fractured portion of the humerus, okay, the surgical neck. Deltoid tuberosity, that's the attachment for the deltoid muscle, that's your shoulder. Okay, and then you can see the rest of the features that we talked about before for the humerus. Okay, now we can kind of see how the ulna top here kind of looks like a scoop or like a little hook. And then the radius, we can't really see it too well, but it kind of looks like a golf tee. All right, so we got all the different features. You can see how there is a sheet of dense connective tissue in between them that helps to hold them together but allow them to move a little bit relative to one another. Okay, and then we have the styloid processes for both the radius and the ulna, where they will articulate with the wrist bones. So now let's talk about the lower limb and the pelvic girdle. So we have 2 bones. We have the coxa here and then the coxa here. They both articulate posteriorly with the sacrum to make the pelvic bowl. In the front, we have a fusion, so a joint between the 2 coxa bones called the pubic symphysis. This is, you should recall, fiber cartilage. There are 3 different portions of the coxa bones that, again, were originally their own bones that have now fused together. The ilium, the ischium, and the pubis. Okay. And then if we look posteriorly, we would also be able to see the coccyx and the tailbone. Okay, so just looking a little bit more closely at the pelvic girdle, you have a huge foramen for the passage of blood vessels and nerves. The acetabulum is where the femur is going to fit into the hip joint. That's pretty much it. Okay, so again, you don't really need to know these features as much as I would have expected previous classes, just with our given situation. And that's going to bring us to the rest of the lower limb. So the femur, that's the thigh bone, biggest bone in the body. Then we have the patella, that is the kneecap. So this is embedded within tendon. And then in your shin or lower leg, that is your tibia is the big weight-bearing bone. The fibula is the one that is located laterally that actually does not bear any weight. Okay, and as you can see, it's very thin, pretty delicate bone. And then articulating with both the fibula and the tibia at the ankle are going to be our tarsals, and then the metatarsals, which we have 5, and then the 14 phalanges. So the big difference between the hand and the feet is that despite having 5 metatarsals, just like the metacarpals, and 14 phalanges, just like the hand, there are only 7 tarsal bones. So it's only 7 ankle bones compared to the 8 wrist bones. Okay, so we can see some of the features of the femur here, and then the tibia and the fibula. So, you know, some kind of interesting stuff. The tibial tuberosity, that's where the patellar tendon is going to attach. We have the gluteal tuberosity here, which is where your gluteus maximus is going to attach. The head that fits into the acetabulum of the coxa, the neck, and then some condyles that will articulate here with the tibia. Okay. Knee joint, again, kind of just for your knowledge, if you want to look more deeply at the knee joint, we're not really going to focus on it too much, but you can see some of the ligaments and tendons that are involved in the knee joint. You can see that there are a lot of things involved because it's really important for the knee to be stable because of how much weight that it bears. Okay, and finally we are at the ankle and the foot. So just like in the hand, we have distal, middle, and proximal phalanges. 1, 2, 3, 4, and 5. So 1 starting at the great toe, and yes, it is called the great toe. And then 2, 3, 4, 5 going all the way down to the pinky toe. But these are metatarsals, not metacarpals, just so that you remember that difference. Okay, and now for the tarsal bones, we have the talus, which is going to articulate with both the fibula and the tibia to form your ankle. The calcaneus protrudes from the back, that is your heel bone. Okay, and then moving forward from that, so anterior to the talus is the navicular bone, and then what will be located laterally is the cuboid bone. And then the 3 smaller bones that are located in front of the navicular, so around metatarsal 1, 2, and 3, these are the cuneiforms. You have a medial one, so this is going to be the one closer to the mid-sagittal line of the body. And then the intermediate cuneiform, which is in between the 3, and then the lateral cuneiform, which is going to be the one that is most lateral towards the side of the foot. And you can see how they all fit together. Get the arch in your foot, which is really important. And yeah, that's pretty much it. So the calcaneal tuberosity here, you could imagine, so this is going to be another attachment for a muscle, but this is where the Achilles tendon is going to attach from your gastrocnemius and soleus muscles, your calf muscles. And that's it for all of the appendicular skeleton. So you can use this to help you with the activity for Monday, as well as what you will need to do on Tuesday to wrap up the bone identification. So by the time we come back from Christmas break, I am going to expect that you know the location of all of the bones in the body, okay, including all of these.